Welcome to another episode of Progress, Potential, and Possibilities, discussions with fascinating people designing a better tomorrow for all of us. I'm your host, Ira Pastor.
Welcome, everybody, again to another episode of our show. Today, bringing you another really awesome guest involved in creating a better tomorrow. Today, we have the honor of being joined by Dr. Joshua Gonzalez. He is co-founder of a really interesting company called Popstar Health. It is a physician-founded sexual wellness company, and they're focused broadly on promoting the importance of sexual health for all people. Dr. Gonzalez is a board-certified urologist who did fellowship training in sexual medicine, specializes in the management of both male and female sexual dysfunctions. He completed his medical education at Columbia University, then went on to do his urological residency at Mount Sinai Medical Center. And throughout his career, Dr. Gonzalez has focused on providing improved health care and improved sexual wellness to all people, but including the LGBTQ plus community, a group that's often left behind in this conversation about sexual and reproductive health, and we'll be talking about that. Dr. Gonzalez also serves as an official sexual health advisor to the Astroglide Lubricant Company, and he's also on the board of directors for the International Society for the Study of Women's Sexual Health. He's appeared on numerous television shows, including The Doctors. He's been featured in Vogue as a medical contributor to Men's Health, Cosmopolitan, Oprah magazines, and he has also a really awesome TikTok channel as well, where he uses social media to further educate the public on sexual and reproductive health. A lot of really interesting topics to get into today. Honored to have him with us. Dr. Joshua Gonzalez, thank you so much for taking time to come on the show today.
Yeah, thanks for having me. I appreciate it.
Just I'd love to start off, as we typically do, by handing you the floor for a little bit, just to talk a little bit more about you. I noticed that in the scientific literature, you actually got started off, publishing and researching a lot about prostate cancer, about all sorts of interesting therapies in terms of adjuvants and some of these new drugs that are out there. And then a little later on, the topics start coming in, premature ejaculation with antidepressant use, sexual dysfunction after colorectal surgery. So sort of making that bridge. Take us back a little bit and tell us the early story to this and how it all sort of evolved for you.
Yeah. I'm impressed you did your homework. I like that. I haven't even thought about those research papers in a very long time. But when I got to medical school, I think that's a good place to start this journey. I didn't even know what urology was. I thought going into medical school that I wanted to be a pediatrician. And then in your third year, that's the first real glimpse into what the everyday life of a particular kind of doctor is, right? So we rotate through different specialties throughout that year. And one block that we had was surgical subspecialties, and it just happened to be the first block that I had. And so I kind of, very quickly realized that I liked the surgical subspecialties, and one of those was urology. So when I rotated through urology, I really was kind of drawn to the people that it attracted. My theory behind that is that because, we as urological surgeons kind of interact with and operate on and have to talk to people about their literal private parts, it sort of attracts a different kind of personality than, say, other surgical subspecialties. I think urologists in general don't sort of take themselves as seriously and tend to be a little bit easier to talk to. And so I was really drawn to that initially. And then I decided to take a year between my third and fourth year to do a research year because I wanted to kind of pad my resume so that I could get into a residency program, because urology is pretty competitive. And so in that year, I applied and got a research fellowship and worked with the urology department at Columbia, where I went to medical school. And most of the research in urology at the academic level, with big academic institutions, is really at the forefront of oncology, right? It's mostly cancer, unless you have like a specific clinical interest in another area of urology. But as a student, they just kind of throw you in with the cancer guys, especially if you don't really know what other options there are. So I was paired with a mentor who, was really great and introduced me to the world of clinical research. But, he had a background on epidemiology and oncology. And so that's how I got started in the oncology research that I eventually published. And then once I eventually matched in urology, went on to Mount Sinai in New York City to do my residency and got even more exposure to the different areas of urology. And that's kind of when I figured that I figured out that I wanted to settle on sexual health. And so at that point, I could then actively make decisions about research projects that I was interested in participating in. And once I finished residency, ended up doing a fellowship in sexual medicine where all of the research that we were doing was really focused on sexual health. So that's kind of my research and I guess clinical journey from, not knowing what urology is at all to being a sexual health, specialist.
Awesome. And I was thinking back, before this show, and we had our first child over 20 years ago now, and at the time, because my wife and I were both over 30, I got tested along with her, and I remember the time the figure came back from my doctor. I'm sorry, I'm giving you my personal story here, but they're like, "Hey, you got 66 million sperm per milliliter, but your morphology and motility are a little low, but this should balance out okay." And yeah, things were okay.
Mm-hmm.
Um, and in getting ready to talk to you, I pulled up, some of these different studies that are out there, and the one that obviously popped up that was quite interesting was this one from a couple of years ago on global trends in
Mm-hmm.
sperm count, which seemed to be plummeting
Yeah.
significantly over the last couple of decades. Back in the early 70s, a normal was something like 104 million per milliliter, and now we're down somewhere in the 40s, and there's this
Yeah.
40 million cutoff, which is not very good for fertility. Talk a little bit about what's going on, if you would, and a little bit of the trends that you focus on in this area when you talk to patients.
Yeah, so I think that the story about the decline in our sort of reproductive health as a species has been, it's been going on for the last 40, 50 years. And the numbers are pretty, staggering. There's been a 50% decline, as you kind of already alluded to, in normal sperm counts, right? And that's not a US problem, that's a global problem. But that is also just one microcosm of a larger decline in men's sexual and reproductive health. So not only do we see lower numbers of sperm counts, but we see lower average testosterone levels among men. We're seeing younger men present with low testosterone that we never would have seen, 50 years ago. We're seeing increased rates of things like testicular cancer and erectile dysfunction. So sort of across the board, we're seeing a decline in sexual and reproductive function among men. And I'm less familiar with female reproductive health, but my guess would be that there's a similar trend. And so what that says is that because it's across all different types of people across different countries around the world, there's something going on environmentally or at a, evolutionary or epigenetic level that we don't even fully understand, because this is happening to people that, in some cases are living what we would consider a relatively healthy lifestyle, but we're still
Right.
seeing this trend going down, and it doesn't appear to be getting better. In fact, it seems to be getting worse. And so there's some estimates that are out there that say that if we continue on this decline, that as early as 2060, humans may not be able to reproduce at all, the old-fashioned way. So things like IVF and some of these other assisted reproductive technologies are only going to grow in popularity. They're the only way to build a family for someone like myself who, is gay and can't have a child the old-fashioned way. And I think with some of the pushback that we saw with like the Alabama decision related to like the IVF stuff,
Sure.
that people are realizing that IVF isn't something that only queer people use to have kids, that it's increasingly something that people require to build families. And I think that that trend is just going to continue.
Perfect. Perfect. Well, let's break it down a little more and go into, so I sort of look at this triad of components that are required for proper fertility. Clearly, sperm count, number one, focusing on amounts, but also motility, morphology,
Mhm.
drive, sexual, have to have a sexual drive, of course, to reproduce, and then sort of erectile function. We'll put these in sort of three different baskets.
Mhm.
Obviously, amount, motility, morphology of sperm, if we start in that basket, what are some other things that we should know, important facts about this particular? I mean, I read that 40 million number. I'm not sure if that's where we're going from there, but you were just pointing out to 2060, which is kind of scary. Um, and myths as well. What are some of the things that you get asked in your practice on a daily basis that are tight underwear, boxer shorts, too
Yeah.
hot, too cold. What are some of the types of things you hear about and suggest in 2024 and pertaining specifically to sperm count in men?
I think one big misconception is that you can tell somebody's like, let's just say, reproductive fitness or maybe their overall health by looking at them, right? So I see a lot of younger men in my practice
Okay.
who are having trouble conceiving. And these guys, I live in Los Angeles. People generally take good care of themselves. They're fit, they're exercising, they're eating healthy, they're doing all of the right things, but they're coming to see me because they're not able to perform in the bedroom. Maybe they're having problems with their erections. They're chronically fatigued. They have no sexual desire. They've been trying to get pregnant for 6+ months and haven't been successful. And, you would look at them and they look like the, perfect male specimen. And then you do a little bit of testing and find that, oh, maybe their testosterone is low, even though they don't look like someone that would have low testosterone, or their sperm counts are off, or like you said, some of the other parameters are non-favorable. Things like motility and morphology are off. So I think that is one thing that needs to be dispelled, is that you can't tell you can't make any judgments on someone's health necessarily, especially as it relates to sexual and reproductive health, just by looking at them. Because there's plenty of people that look like they should be able to procreate pretty easily that can't. And so that's something that I run into a lot. When you're talking about reproductive health and we're counseling patients, who may have less than optimal semen parameters, we do go over like the kind of basic stuff, like, if they're sitting in a hot tub, every day or a few nights a week, that's not going to be great for their sperm production. One thing that I run into a lot, especially in some of the gay male patients I have, many of those men that have been put on testosterone replacement therapy by outside providers because maybe they presented with some of the symptoms that I, just mentioned, and had measurably low testosterone. A lot of people aren't told that when you are on testosterone replacement therapy, it can dramatically affect your sperm production and sometimes make it so you don't produce any sperm.
Got it.
And so I think what happens a lot of times in these specific cases is that men aren't told, gay men aren't told, maybe because the prescribing person assumed that they didn't want a family. And so I end up seeing them and ask them if they are aware of the effects on sperm production, and many times they're not. And then we have to kind of undo this problem and, you know, switch them to a different medication that, will hopefully maintain their testosterone levels at a healthy range while also trying to stimulate their testicle to kind of start up again and start producing sperm. And so that's another big misconception, is that I don't think people understand the relationship between exogenous testosterone use, right? Not just the
Yeah.
testosterone that your body is making, but like if you are replacing or supplementing
Yeah.
your body with an external form of testosterone, the detrimental effects that can have on your fertility. And, along those lines too, people that use steroids for bodybuilding or to get a certain, aesthetic appearance, that can have detrimental effects on your sexual health. A lot of people, think that, oh, well, if I'm on these medications or on these treatments and my testosterone's through the roof, I'm going to be horny all the time and I'm going to be, a walking erection and be able to, I shouldn't have any problems with my sexual function. And the truth is we see tons of steroid-induced sexual dysfunction. So I think, people unfortunately lack the information that would be helpful for them to kind of make decisions about using these various treatments, in terms of how they affect sexual and reproductive health.
Excellent. And while we're on the topic of testosterone, and I sort of put that in the bucket of sexual drive, as it pertains to men, I enjoyed watching your TikTok channel also, and Instagram, and preparing for this, and watch several of the testosterone episodes, specifically the one on I guess the recent paper on prostate and heart health. But again, one of the things that you point out is testosterone, yes, but there's a lot more to the testosterone story. There's bound, there's free, there's the steroid binding globulins, there's this called cortisol issue nowadays that we hear about, and then all this other, there's the whole other neuroendocrine. We're more than testosterone as men, right? I mean, there's a lot of other hormones and interesting bioactives going on in the arousal process. Talk about that a bit, if you would.
Yeah, I mean, so when you are referring to libido or sexual desire, right? That is a process, that is a phenomenon that is multi-layered. We oftentimes, one of the first things we will do if someone is coming to us with low sexual desire is check their hormones. And certainly if something is not in an optimal range, we will provide them a solution to fix that. So if somebody's testosterone is suboptimal, we'll put them on a treatment to raise that testosterone. But that's not the whole story. Libido is influenced by, as you kind of alluded to, certain neurotransmitters. It's affected by what you're dealing with in life. It's affected by stress. It's affected by your relationship dynamic. It's affected by other mental health factors, right? Depression, anxiety. And so we really have to think comprehensively when we're trying to solve a libido problem for an individual, right? It might be medication related. Maybe they have a history of depression. They were put on a medication. Now their mood is stable, but one of the side effects of their medication is causing low desire. So we have to be really comprehensive about how we evaluate someone's low desire, because just putting them on testosterone isn't always the only necessary thing to do. And so, we often, if someone is on a medication that has a negative impact on desire, we'll talk to them about having a conversation with their prescribing provider. Is there an alternative that they can be put on that would have less effect on their desire? Or maybe we need to start a medication to counteract the effects of that antidepressant. There are certain neurotransmitters in the brain that we call, sex positive neurotransmitters. Those are like substances like dopamine and norepinephrine.
Right.
There are sex negative neurotransmitters. The biggest one is serotonin. And so there's a class of medications called serotonin selective reuptake inhibitors, SSRIs. They're very commonly prescribed for antidepressants. Those medicines work on depression and anxiety by allowing serotonin to continue existing at the neuronal synapses, right? So you can think of it as a net increase in serotonin. Well, if that is an inhibitory molecule when it comes to sexual function, having more of that is going to be have a negative impact on your sexual function. And the opposite is true for dopamine and norepinephrine. So more of those two should have a positive impact on sexual function, including things like desire. So we use that knowledge to prescribe medications all off-label, because there are not really any FDA-approved medications for low desire in all people. I can talk to you in a minute about a couple that are indicated for a specific condition called hypoactive sexual desire disorder. But just your run-of-the-mill kind of low libido, there are not any FDA-approved medications. So what we do is we prescribe medicines that we know that work on the brain and shift that balance in neurotransmitters to try to have a positive effect on desire. There is a condition called hypoactive sexual desire disorder. More than 5 years ago, 2 medications were approved by the FDA for HSDD in women. which was a very big deal at the time, still is a big deal, because at the time there had never been an FDA-approved medication that directly addressed a female sexual dysfunction. There have been a number that have come out since then, but that was really what kind of opened the gates and really started the conversation amongst providers about the necessity for drugs targeting female-specific sexual dysfunctions. So these two medications, one is a pill that you take every day, the other is an injection that you use on demand, similar to how a man would use Viagra or Cialis.
Okay, sure.
Both have been shown to increase sexual desire in women. We also use that knowledge and prescribe those medications all the time off-label for men as well. So, we kind of have to use the knowledge about certain physiology and knowledge of how the medications that are available to us, how those work. And then we use that knowledge off-label to prescribe these medications to, improve desire.
Awesome. No, I enjoy always hearing about what I call repurposing stories of this nature, especially when the pharma industry has, neglected, let's say, certain unmet needs. So no, that's great. And while we're there, and then we'll get into Popstar in a minute, but if you could just, because you mentioned Viagra before, clearly the phosphodiesterase 5 products, Levitra, Cialis, and Viagra came on the scene, a couple decades ago. Where, thoughts, where are we going beyond sort of those products? I mean, do you see anything on the horizon there? I mean, I know there's when we talk about Popstar, you're looking at more natural alternatives that potentially could do some of that stuff. But just sort of the erectile dysfunction landscape, are we sort of happy with what we have in terms of the pharmacotherapeutic armamentaria? Or
I mean, I think men are pretty fortunate. They have a lot of options when it comes to erectile dysfunction. So there's 4 oral medications that men can use. You mentioned 2 of them, Viagra and Cialis. There's another medication called Levitra, and the most recent one is Stendra. Stendra's been out for, I think, more than 10 years now. They all work very similarly, for a variety of reasons. Some people respond better to one versus another. So they're, we try different ones with different people, but they all tend to work the same way. They all inhibit the PDE5 enzyme. So, and that results in an increase in nitric oxide, which causes vasodilation of the blood vessels, and that's why those medicines work. Beyond that, if patients don't respond to oral medications, there are injection medications that they can inject directly into the penis that are very potent vasodilators, way more potent than any of the oral medications that are available. And interestingly enough, people think when they first hear about that, because no one really knows about the injections unless they really have a problem and have seen a doctor who has talked to them about it. People think that that's some like new technology. That those injections have actually been around longer than Viagra and Cialis. They were just very dangerous. They still are. They can still be very dangerous if you are, not going to someone who knows what they're doing and prescribing that a strength that is appropriate for you. You can develop a prolonged erection. It can become an emergency situation. It can cause, irreversible erectile dysfunction. So there's some education that needs to happen around those injectable therapies, but those can work very well for men who don't respond to oral medications. The question is what do we do with men who don't respond to those agents, right? Historically, they would be, kind of counseled on the benefit of penile implant surgery, which basically replaces the erectile tissue that doesn't seem to be functioning normally anymore with an inflatable device. But there's a lot of men that just don't want to do that surgery. And at least in my experience, it's a surgery that I, I've loved doing throughout my career, but it's not something that people are necessarily always interested in. And so there's this gap where people I think are looking for something else. I think there is some promise in the area of regenerative therapies. We do low intensity shockwave therapy in my office, which has some reasonably good data from Europe. There's not any large clinical trials in the US that have been published, but there's good data from Europe showing improvements in erectile function with shockwave therapy. I think the one thing I will say regarding shockwave therapy, though, is that there's many devices out there. Some have even been marketed towards people, on platforms like Facebook that can be used at home. These devices are not all created equal, so you definitely
Right.
want to kind of do your research and make sure that wherever you're going to get these treatments, that it represents a true shockwave device and not something else, because you're not going to get the benefit. If you don't get the actual technology that's been shown to work. Beyond that, there are biologic agents that can be used. There's platelet-rich plasma.
Yep.
The data is weak on that, but we've seen it be helpful in other areas of medicine. So there may be something there at some point. There's a new interest in exosomes, which are often sourced from stem cells. They promote regeneration of tissue. And so, similar, a lot of the stuff that's happening kind of in the dermatological space with, facial rejuvenation, promoting collagen production, that's essentially regeneration of the cells in the face, right? We try to find similar treatments that could potentially have the same effect on the erectile tissue. So I think regenerative therapy is exciting. And yeah, I would say, we just need to get better data on it. We need to actually do like the clinical trials necessary, because no one knows how often we should be doing these things, who's the best candidates for it, who's going to probably not respond and be better served by something like penile implant surgery. So those questions are largely unanswered.
No.
Yeah.
I really appreciate that insight, and it feeds back to something you mentioned at the very beginning when we were talking about this fertility issue, and these there's this epigenetic thing, and epigenetics is becoming such a hot topic nowadays, and
Yeah.
in terms of turning on and off genes, and yeah, I think there's it's a very fruitful area of exploration, and offers a lot of possibilities
Yeah,
for
I
for the
think
future of your space.
one thing I wanted to mention, this doesn't have to do directly with erectile dysfunction or the treatments that we have for it, but is related. And I think that it's an important point to share with people, is the relationship between erectile dysfunction and cardiovascular dysfunction. So
Okay.
ED for many men happens because of a decline in blood flow to their penis, or because they're incapable of trapping the blood in their penis during arousal. And there's a lot of data that have come out in the last 20 years that have shown that erectile dysfunction for many men can be the first sign of undiagnosed cardiovascular disease. It's sort of the canary in the coal mine, right? So you might have a guy who has no history of, heart attack, no history of stroke. Maybe his blood pressure is borderline, but he's not on any medication for it. Doesn't go to the doctor very often, but shows up in my office with erectile dysfunction. And we, do some testing here that looks at, our patient's blood flow, while they're having an erection. And if we find that they have arterial insufficiency or another vascular issue, that guy should probably be screened for, underlying cardiovascular disease, because that is a known risk factor. And so there is a medicine that we use for ED, Cialis, which is available in a low dose daily amount, that has been shown to help stabilize the endothelial lining, which is the lining of our blood vessels. And so even when I was in residency, which is now more than 10 years ago, one of my mentors back then said, if this drug was cheap enough and people could get it, this is a better medication for people to take on a daily basis than aspirin. And after you get to be of a certain age, a lot of people end up getting put on a baby aspirin, preventatively.
Sure.
But a medicine like Cialis actually is more sort of cardiovascular protective than even aspirin. And so there's a cool kind of link between sexual health and cardiovascular health. And I think we'll probably see more of that, because that medication is now generic, and it's more readily available. And so there's a lot of people who think that if we put more, primarily men, because that's who ends up getting prescribed this medication, but a lot more people on this medicine, that it would help them with cardiovascular function.
That's fascinating. And it just, it feeds back to the old, because, as you know, the PDE5 products, going back to Pfizer and everything 30 some odd years ago, were being developed as uh as drugs for hypertension. And
Yeah.
it was, there's the old story that it was the nurses in the phase 1 studies that noticed that all the men were sleeping on their backs, and
Yeah.
that was the first aha moment, there was something happening here. But no, that's awesome. Um, let's go into to Popstar now. Love to hear the story about everything you have going on. Obviously, you're partnered with another, really awesome urologist, Dr. Brian Steixner, who UPenn down the street here, CHOP, doing some really amazing stuff in the urological space early on with children and surgeries and things of that nature. Talk about how you guys got together, a little bit about, what got you to form the company, because I know Brian had a whole story as well with some of these issues
Yeah.
that's on the website, and a little bit of what you're creating, because I know you're focusing on nutraceuticals, and I think that's great because this is a major consumer driven space.
Yeah.
Talk a little bit about everything that's going on.
Yeah. So Brian and I have, known each other probably 10 years now. And Popstar as a company really started out as just like a harebrained idea. That we put our heads together early COVID. As you can imagine, when people were stuck at home, there was not a lot of people coming to see their sexual health doctors. And so Brian and I were chatting. He's always kind of been a mentor to me. And I was seeing a lot of guys in my practice complaining about low volume ejaculate and how they didn't, their loads were not as big as they used to be, and it was having a negative impact on their sexual function. Orgasms didn't feel as intense anymore. And there wasn't, I mean, there's medications that we can sometimes put people on to increase their volume. Um, but a lot of people don't want to be on medication for a problem like that, right? They're like, is there a solution that I can do that will improve my ejaculatory volume and make me have better sex, but that isn't a medication? And there was some, kind of gas station-y type supplements that I had seen that I didn't feel really comfortable recommending to my patients. I wasn't sure about their safety and certainly wasn't convinced that they were effective. And so, while we had a little extra time on our hands, we were like, well, let's just see what we can come up with. So we did a lot of research in the fertility space because that's mostly where information about semen volume comes from, and put together our initial formulation, which was essentially a comprehensive semen health supplement. It was a volume and taste enhancing um, supplement that men were supposed to take every day to essentially make their volume bigger, their orgasms more intense. And that company, that initial idea has grown into, a full-fledged company that Brian and I run together. And when we started to see the success of the volume and taste enhancer, we were getting a lot of questions from people who wanted to know if it would help them with their fertility journey. And while there were ingredients in that initial formulation that we know improve sperm health, it wasn't a fertility supplement. And Brian and I both, Brian's story is on our website, but and he totally fine with me sharing the story. Brian and I both have our own kind of unique relationship to fertility struggles. He and his wife have two beautiful kids through IVF. And so, he's been very open about that journey that he had to go through, and the kind of embarrassment and shame that he had going through that process with his wife, and almost a feeling of there was nothing he could do, right? So he at the time did research and started taking a bunch of different ingredients separately to try to do whatever he could to optimize his fertility journey. And then, my story is a little bit different. I'm, currently in the process with my partner of waiting to match with a surrogate. So we are very familiar with the clinical sides of IVF and fertility, and thankfully we didn't have any problems with our semen parameters, but understand, having gone through this process, how demoralizing it can be, how difficult it can be, how time consuming it can be, how expensive it can be. And so it just made sense for our next product to be a fertility focused supplement. And so we, went back to the drawing board and said, what do we think based on the available literature are the best ingredients that we can put in a supplement that a guy can take to optimize his fertility potential? And then when we launched that product late last year, our goal with Popstar Fertility was to educate men on their role in fertility, right?
Sure.
What Brian and I recognized, having gone through these processes ourselves, is that so much of the weight of fertility is put on women, and that there isn't enough conversations happening with men, especially in the context of what we started this conversation with this global decline in sperm production, right?
Yep.
There's not enough conversations happening about what men can do to facilitate, conception or to optimize their fertility. And so we've really made it our goal to provide resources to patients on taking this supplement and making lifestyle changes and doing what they can before they're even ready to have a kid, right? This should be something that you do proactively and as a preventative measure to optimize your fertility, because more and more people are waiting longer and longer to have kids, and you don't want to be in a position where you're in your mid to late 30s for the first time trying to actively conceive, and that's when you're figuring out your sperm counts are low, right? Men should be doing things in their 20s and maybe that's lifestyle modifications, but maybe it's taking a daily supplement like Popstar to really optimize their fertility, and maybe even consider banking their sperm at that point. Because if we're seeing such precipitous declines in sperm production, your sperm production, in your early 20s is the best it's going to be. And so it may be at that point, even before you're ready to have kids, where you consider something like sperm banking.
But speaking, along those lines of not enough conversation, okay, no, we haven't been talking about as men about this particular issue. Let's talk about some of these other areas, because I think, obviously you're an expert and you spend a lot of time per the LGBTQ plus community. What are some of the other issues there in terms of the conversations that we're not having broadly as we talk about improved sexual health care and reproductive education in that segment?
Yeah, I mean, as it applies to the LGBTQ plus community, I think those conversations are being had even less, because certain assumptions, I think, unfortunately get made about people in the queer community. I know this because I've encountered it myself. That just assume people don't want families if they're gay, lesbian, bisexual, transgender, right? Or that they don't value their reproductive health. That's not their focus. And so sometimes those just conversations never get started, and so it really ends up being this kind of grassroots sort of word of mouth discussion that happens amongst people in our community, where it's like, okay, when I was ready to start family planning, I talked to my friend who had been through the process a year before, and he learned from another friend of ours who had done it a couple years before that. And so you end up going to all the same doctors because we've all spoken to each other about it. But so I think there's not a lot of conversations about sexual and health in general in medicine, or there's not enough conversations about it. And then when you focus on, let's just say, non-heterosexual sexual health or reproductive health for people that identify as queer, then those conversations are happening even less. And so it's got to change. I mean, I think it starts with our medical education. I think we as physicians need to do a better job, or the people teaching young physicians need to do a better job of valuing sexual and reproductive health, making it an integral part of our education, which I would say, at least when I went through the process, it was not. And then making sure that when you are hitting those topics, that it's an inclusive education. that it includes how do you discuss these sensitive topics with everybody, not just the straight couple that you're assuming cares about having a kid.
Mhm. And I'm going to assume this next category gets even less attention, but because we're not talking about the need for fertility here, but for sexual longevity, and sort of this topic of health span has become very important for us. The ability to extend the healthy, the typical part of life that may not be too healthy as we age. People
Mhm.
aging longer, potentially staying healthy longer, and wanting to be sexually active longer. And it's like, well, I don't think about my parents having sex, well, my grandparents having sex, but clearly, the grandparents would have sex. Um,
Yeah,
what's happening in the space of aging and longevity specifically? Because here you're not going to be focusing on, I'm not going to conceive at
right.
85, but you know, there's
Yeah, I
other
mean, I
things they
think
want.
I listen, whenever I have patients in my office, it doesn't matter their age. I have guys like in their early 20s, and I have a guy who is 81 who comes in very regularly, is very motivated to continue to be able to have sex. And, I hope I'm in that same position when I'm his age. But you're right, people are living longer. People want to not just live longer, they want to live healthier during that prolonged life, right? They don't want to just give up on things that make them happy, including sex. And so for me, it's just about finding ways to kind of optimize their sexual health. And maybe that changes for someone as they get older. Maybe it's not going to involve penetrative sex.
Mhm.
Maybe it's going to involve some sort of kind of sexual activity or intimacy. But if someone's really motivated, there's solutions out there. It doesn't matter what your age is. Um, and so I tell people, if you are motivated enough, there's never a point in your life where you have to give up on sex or cut it out altogether. If it's something that is valuable to you and important to you, we will make sure that you continue to have a satisfying sexual life, for the entirety of your life.
Mhm. Outstanding. Um, just one other thing I wanted to ask you about while we have you today, and I really do appreciate your time, and all the knowledge you're imparting upon us. Um, I Back, I think it was like 2016 or so, you had this one paper. It was quite interesting. It was, I'll just read the title here. Peripheral female genital arousal is assessed by thermography following topical genital application of alprostestal versus placebo. And interesting here, this thermography, this really complicated digital infrared thermal imaging
Yeah.
of the body. And this paper was cool. It was a cool paper, but it got me thinking about sort of this whole area of sex tech that we've heard a little bit about. Obviously, you're working on the therapeutics and the nutraceuticals and so forth. Anything interesting happening on sort of the digital side here? Because we talk about digital health. Femtech has been an interesting topic for us on the
Mhm.
show. Anything interesting happening in sort of the digital wearables, like do it at home sort of
Yeah.
diagnostics for sexual health that get you excited, that potentially are companion products for some of the products you're selling?
Yeah, yeah. So there's a company called Firm Tech that Popstar's actually done like kind of collaborative work with. Given the nature of our products, they work well together. And they have basically like a Fitbit for your penis. So
Okay.
it's a constriction ring, right, that men use oftentimes to help them maintain an erection. And I think they have a couple different versions, but the highest techie one, you can wear at night, and it will give you information about the number of erections that you have at night. And there's programs in the device itself that can teach you how to sort of like strengthen your erection. So, I wouldn't be surprised if, people more and more start to use wearable devices on their private parts, similar to my Apple Watch here. But yeah, and that company, from what I understand, is also looking at something similar for the clitoris, so that they can assess clitoral arousal and hopefully help improve arousal for women. And so, yeah, I mean, I think there's a lot of promise in the sex tech space. That you're going to see a lot more uh, integration of technology into the bedroom for sure. There's also a couple of other things that have come out in the last few years that I think are really interesting, and this kind of gets back to the reproductive stuff. You can do a semen analysis at home now.
Okay.
So when I started my IVF process, had to go to the doctor's office, go into a room with a cup, give my specimen the old-fashioned way, give it to the lab, they process the sperm. But if someone is, embarrassed or maybe just curious about what their semen parameters look like and don't want to go through that process, there's a couple of companies that you can order a kit online. They send it to you. You do the specimen collection at home. You pour in the preservative according to the instructions, and you send it back to them, and they print out a semen analysis for you. And a lot of people who don't know what they're looking at may be confused by it. So I definitely recommend, if you're going to do that and you have questions, you should consult a healthcare provider to explain the findings to you. But that's really cool. People can literally do a semen analysis and cryopreserve at home. So this goes back to what I was saying earlier about that 25-year-old guy who maybe he's not ready to have a kid now, might not be for 10 years. What can he do to be proactive about his reproductive health? Maybe it's taking Popstar Fertility every day and getting doing an at-home semen analysis kit and banking that sperm, because it can stay frozen forever, and he ultimately may not need to use it and can have it like discarded later. But who knows what's going to happen to him over the next, 10, 15 years when he might be then ready to have a kid. Maybe his counts aren't as good, and then he can go back and use that specimen that he collected in the comfort of his own home. So I think there's a lot of interesting stuff happening around in the sexual and reproductive health space for sure.
It was, some years ago, because we had 3 kids, and there came a point, all right, so I went and got my vasectomy, and I remember buying one of those kits. It was years ago, and I was like, look at the results. I'm like, I still want to go see my doctor just to make sure, because but I'm sure those products have evolved substantially. So now that's great to know, especially in this sort of do it at home, sort of like healthcare in the home era we're in. So no, that's exciting. Josh, did I miss anything? Anything coming up in terms of public-facing initiatives for the company, for your practice? Anything else happening in 2024 that we should know about in terms of you or Popstar? Please take the floor, in case I missed anything.
Yeah, no, I mean, I think I'm excited for this next year for Popstar, to continue to grow the 2 products that we have. I think we eventually want this to become a sort of comprehensive sexual health and wellness company. We have some ideas of future products that we would like to develop that really, everything that we develop is not just to put another product out there. It's really, as I shared about the fertility thing, something that is personal to us or is trying to address a specific problem that either Brian or I have encountered in our clinical practice, right? So we want to develop products that solve a problem that we are seeing in our practice, that we don't feel the needs are being met by what's available. So I'm excited for the future of this company. Right now, we're focused mostly on growing these 2 products and getting the word out there, and also using our platforms to just help educate patients and individuals on sexual and reproductive health. But I think I see big things for the company down the road. In terms of my practice, I mean, I just moved into a new office space in LA. We're, just trying to expand. Hopefully we'll start doing clinical research in my new office space. So I'm excited about that. And then in sexual health in general, I think there's a lot of things that are happening that are really interesting. There's this sort of movement right now happening around perimenopause and menopause, where you're seeing well-known public figures come out and talk about their experience with menopause and normalizing it, and talking about a lot of the misinformation that's out there. And you're starting to see some of the last 20 years that we've been dealing with, where women haven't really been offered hormone replacement therapy. You're starting to see that crack a little bit finally, because it's really not based in any good scientific data. And people like myself who work in the menopause world finally having patients come to our office who've educated themselves and say, like I've looked at stuff online and I'm experiencing all these symptoms and I want you to help me, and not being scared that they're going to get cancer or some other, terrible side effect that they've been told about in the past. So I think that's a really interesting area to keep an eye out for too.
Awesome. Really awesome. I'm excited for you. For Popstar, for your own practice, for your TikTok channel, which is awesome too, and we'll obviously be putting the link in the bio of the show. But really, really great stuff, Josh. I'm gonna continue to follow you and take in all your knowledge. And again, I think what you're doing is awesome, and this is, as we talk about these unmet needs, this is a major one, and I'm glad that you're focusing on it from all these different angles, from the nutraceuticals to traditional pharma to some of the regenerative medicine opportunities, and it's just really exciting. For everybody that is going to be listening to this particular episode of our show across the various podcast networks, or who will be watching on our YouTube channel, again, you've been spending time with Dr. Joshua Gonzalez, co-founder of Popstar Health, physician-founded sexual wellness company focused on improving sexual health for everybody. Josh, I really want to thank you for taking the time out of your schedule to talk to us for a little while, to educate us on a wide range of topics. Obviously, thank you for everything you do for the sexual health space. And as we like to say on our show, thanks for helping to create a better tomorrow for everybody out there. It's really a great story, and wishing you and the team the best with it as the company continues to grow.
I appreciate it. Thank you for having me.